than 548 million confirmed cases of COVID-19 worldwide. More than 6.33 million people die worldwide due to COVID. Today, we have invited acupuncturist and herbal specialist DR.LU, who have been helping to treat the frontline medical staffs and their families, friends, and COVID patients. Professor Lu received appreciation letters from 3 of our US presidents. In February of this year, he won a Global Outstanding Chinese Award of Lifetime Achievement. Professor Lu and her group of volunteers have helped to donate more than 500,000 air rescue herbal capsules worldwide. Recently, she and her rescuers volunteers made a donation of more than 8,000 plus boxes of her air rescue products in Taiwan and successfully rescued all those COVID patients. Today, we have invited Professor Lu to be with us on Zoom to share with us her incredible findings. Let's welcome Professor Lu.
Hello, Sammy. Hello, everyone.
Since the beginning of June of this year, the COVID death rate was high in Taiwan. Taiwan had an average of more than 100 plus deaths per day, some days even more than 200 deaths. But out of 800 boxes of capsules, which you have donated in Taiwan, none of these COVID patients died, including COVID patients who were on kidney dialysis and end-stage lung cancer, brain cancer, blood clots, cardiovascular diseases, and other chronic illness.
Hello everyone, I'm in Taiwan now. I got COVID-19 on July 4. So I must stay at home now. And the government gave me a test result certificate and other issued me home isolation. I'm a drug allergic person, so I can't get vaccinated. Doctor gave me a diagnosis. So on the first day, I got fever and muscle, very pain and fatigue and weakness. So I can't open my eyes and I can't smell anything. I'm so scared. I thought it was different from a normal flu. This is very different. I couldn't get up at all and I was very uncomfortable. But I think I'm so lucky people because last year I met DR.LU and who prepared some capsules for me in the West. So I just by taking 3 capsules, a few hours later, my symptoms completely disappeared. Then I continued to take 4 capsules after waking up. And the next day, no discomfort at all. So now I trust DR.LU even more. And I could like to thank for her again. Thank you so much, DR.LU.
那我现在站出来分享一下我自己本身对这个药丸、对新冠、对这个确诊非常好用，所以在这里我这个很感谢我们吕中医师有这样的一个研发的这个好的东西，中药材可以救人。那在这里我还是再三的感谢吕中医师，好，谢谢。
谢谢吕医师，让我们知了都一信。
We heard that your team helped to rescue a lot of children and several infants under the age of 1 in Taiwan.
Oh, yeah, yes. We did rescue a lot of children that were under the age of through some volunteers. And my youngest patient now worldwide is like 5 months old. Yeah, and we have several that were infants that were under 1. And we rescue like a patient that were kidney dialysis, and I had a patient that had lung cancer and brain cancer who also had the COVID. So, and then other patients that they had high blood pressure, diabetic patients. So we all rescue them back. And then there were some patients that were actually in the IC unit, and we got them back also from the IC unit, and then got them off the inhaler, the ventilation system.
Wow, we heard many of stories about your rescue work. One of the patients with the cardiovascular disease was originally sent to an intensive care unit and took your capsules, then was quickly discharged from the hospital the next day. Recently, the big news that we heard was the patient with terminal lung and brain cancer also recovered quickly after being diagnosed with the Omicron. Can you tell us about it?
Yes, the one that had the cardiovascular diseases, and it was actually referred by one of the reporter, a TV reporter. And then she called me up one night, and then I think the time was like around almost 2 a.m. in the morning in Taiwan. And then she called me up. She said, "Oh, this old man needs help, and then he got COVID, and then they think he's at a very high risk," which he was. So they sent my capsule over, like I think around 2:30 a.m. and then rescue that patient back. The next day, he successfully exited the hospital. Yeah, they were gonna put him in the IC unit, but he took my capsule. The next day he exited. And the other patient that had the lung cancer, and stage lung cancer, and also brain cancer, he took my capsule, I think early May. And he told me that he would actually recover within 3 days, all the symptoms. He recovered from COVID. Wow. And then I told him, I told him to go to the hospital to make sure, because he's at higher risk. So I told him, you need to go to the hospital to make sure you're negative, And he went the next day. Yeah, he was negative. So it was very quickly. And June 22nd, he called me again, because I was helping him monitoring other stuff, his cancer index and all that. And he told me that his cancer number, actually went down, and his tumor was shrinking. Yeah, wow. That was so
miracle. Oh, so quick and wow, impressive.
Yeah, so it's sometimes it's a miracle. I try to help a patient with with their COVID symptoms, and then they ended up getting other diseases cured, And then I had a lot of patients that had high blood pressure, and then while I was treating them, their COVID symptoms, they actually recovered, and their blood pressure went down to like a normal range.
This is really a miracle, so special. So in the ancient legends with an ancient fairy birth month, you can save a lot of people. Presently, you still maintain an incredible 0% death rate in COVID patients, right? Can COVID patients with cardiovascular disease or patient on kidney dialysis can be rescued as well?
Oh yes, of course. Well, like you know, right now, like right now, I still have a 0% death rate for COVID. So all the patients that I had, patients that many were in the ICU unit, and people that were you know, ventilation system, they have breathing problems or other things, and people that have chronic illnesses, and also cancer patients. They after they caught COVID, and then we rescue them, usually 1 or 2 days. Yeah. And the symptoms, recover from the symptoms. But to the patients who turn negative, it's like within 3 to 7 days. Some patient, actually, I have some patient that as fast as the same day, that after they took my capsule, they turn negative within the same day. But certain people, maybe if they don't sanitize well, you know how the viruses are within you, you know, around you, right? If the patient has COVID and they cough, and then they produce more viruses around them, and then if sometimes the patients forgot to change a toothpaste, toothbrush, and then they can get the COVID back. So usually 3 to 7 days they turn negative, so very fast. And people that I had a few patients that were on kidney dialysis, yeah, they are okay very fast also. Yeah, 3 to 7 days they turn negative.
Many people have developed long COVID now. Can traditional Chinese medicine offer treatment for this?
Oh, yes. Yeah. TCM, the traditional Chinese medicine, yeah, TCM medicine is very good for people that have long COVID symptoms, because we're very strong at treating the patient when they're weak, you know, when their body is weak. It's like they need more nutrients, so that's one of our expertise. If they can combine acupuncture, is even better. Acupuncture will help them, yeah, to circulate and promote qi, blood and qi. So it will help the patient with long COVID to recover fast. But if the patient has like a brain fog is not as easy, because you can just maybe you can needle by weight and some parts, some acupuncture points on your head, or to help promote, but you still need herbal formula, to promote this, to make sure the nutrient will go into your brain and all that. And so brain fog is a little more difficult than what normal people can treat. So I did develop like an herbal formula for brain fog. It works very well, and it can help the patient to recover fast.
I noticed that you look younger than what I saw you on TV before. Your formula is young and beautiful for female patients, right? So is that helpful for men who wish to look younger, to healthier, and good for their heart, their liver, their spleens, or lung, or kidney? Is that okay? I mean, for men, do you recommend them also take your capsule?
Oh, yes. Actually, it does for both men and women, and then I actually, when I was doing the developing the brain fog, this formula, I found that it made me look younger. So I, continued to, I took more myself, and it can help with a lot of issue, because I added some ingredients that can, that will help with the anti-aging issue, and then help to repair, to do cell repairing. So it will help, not just your outside, your brain looks better, but also inside. So I combine this nutrient with the my herbal formula. So yeah, it works very well. And people that, usually like they go to the bathroom a lot, and then now they can it will become less frequent, like things like that.
Oh, that's nice. So many people have received the fourth dosage of the COVID vaccine. Do you think this can effectively prevent the new wave of Omicron BA4, BA5?
Well, actually, of course, if you are a believer in the, in vaccination, yeah, because I took I took 3 shots before, but I have to tell you that after my second shot, I took Moderna. So after my second shot, I got weaker, and then I didn't actually in the beginning realize it was the vaccination like right away, because my first shot I was fine, and then the second shot I started my body got weaker and weaker. So I didn't want to take the third shot, but I had to travel. So, and then there were the entry, like certain country, when you travel, they would require you to take the second shot or the third shot. So I ended up taking the third shot. But after the third shot, same thing happened. My body got weaker. So for myself, I don't think vaccination is the best choice for me. And I travel so many times. Even I went to Africa and Middle East, and I went to Asian countries. I have never gotten like a COVID positive report. So and then I just use my own capsule to prevent.
Oh, so you are going to rely on your own capsule to save yourself. So there is no more vaccine for you for now.
Yeah, I hope I don't have to take it. Yes, but every country, they have a different rule. So it depends on whether or not I need to travel, to do something. And then if I need to travel and then the law requires me to take the fourth shot, then I have to, but I'm trying to not to get my fourth shot.
So the air residue herbal capsules you develop can prevent the coronavirus. That is scientific medicine according to TCM. That is a scientific medicine according to traditional Chinese medicine theory. The superior doctor prevents the disease.
People ask me if this can prevent. We have to test a lot of patients before we can tell people that it prevents. You have to have evidence. So after I treated many patients, and then a lot of course, people that they also, have our capsules and they use it for traveling, for maybe before they go to like a meeting, parties, or they attend a public transportation. We found that people that were doing it, they were like me, that they don't get, they don't catch COVID. Even my neighbor got it. My neighbor's whole family got it. And then I had an issue that I went to like a wedding. And then the next day we got notified that, our next table got COVID, but I never got, I never got the positive report, nothing. Yeah, maybe I contacted, but I mean, my capsule helped me to actually prevent myself from getting COVID. Yeah, it's very, very effective.
Thank you so much for the information. Thank you, Professor Lu, for joining our event, joining our Zoom meeting. Thank you so much.
Thank you, Sammy. Thank you so much.